So in the department, and that is in instrumentation engineering. And currently we have around 40 odd students for the PhD enrolled in the department. This program, Wearable Technologies, this is now the supported and sponsored by the AICT under Atal scheme. And we are very fortunate that COEP this time we have received the 2 such programs. Out of that, this is one of the programs. This is a 1-week program where we have arranged the lectures starting from the introduction to the wearable technologies to the market review and design of wearable technologies. Then microcontrollers, those are supporting the wearable technologies, their protocols. So we have tried to cover most of the topics related to the wearable technologies. And from the experts, those are really working in this area, like Professor Arnab is there. So I request Dr. Arnab, please do continue your session. Thank you. Thank you so much. And thank you, the organizer, Dr. Kalyani.
Okay, so first of all, I would like to thank Dr. Sonamane again for the nice introduction, and Dr. Kalyani for the organizing the nice event. So today, I am Dr. Arnab from the Center for Biomedical Engineering, as Dr. Kalyani has introduced in IIT Delhi, and I'll be speaking about an overview of the wearable technologies in healthcare, which is a very exciting topic, and it is going to be the new big topic for India in the coming years. So next slide, please. Somewhere on your body location where you want to measure something, they can also be not on the body, like on a chair. Let's say you want to measure your posture and some other parameters, so they can be up in a chair or some other place where you're doing an interaction which has an interaction with your body. So wearable technology can detect, analyze, and transmit body signals continuously and monitor physical and behavior such as steps, your energy at a certain point in the day, and also the physiological parameters such as body temperature and heart rate, like for example. So we will get into more and more detail why these parameters are important, what these technologies are doing. And the third is a biochemical parameter such as pH and glucose. For example, are you sweating or is your body dehydrated? There are a lot of indicators which can be helpful. Through the wearable technology, we can get that information. So we usually use a smartphone to collect the data and store on a remote server. So 17,000 rupees, and another expensive one, which is the Apple Watch, which is about 40,000 rupees. So I've never bought one for myself, but this is one of the key things which comes into mind when you say wearable technology. So within this presentation, we are going to talk about how wearable technology is much beyond a Fitbit and an Apple Watch. So third slide, please.
Yes, sir. I'm on third slide.
Thank you. So wearable technology, like I said, is a lot more than Fitbits and Apple Watches, which are not a very cost-effective consumer solution for the Indian market specifically, and we'll look into all those details as we come along. They are mainly used for prevention of diseases and maintenance of health, patient management, and disease management. So these are the three major topics in which we are going to look at the future of wearable technologies and where they are right now in the market. So another key fact is most of the wearable technologies are still in the prototype stages. What that means is most of these technologies are still being developed at some research lab. Like very few of these technologies are actually out there in the market, like which me or you can use. So some of the figures here, the first one shows a hand gear where rather than using a keyboard, if you have used a computer or a laptop, you are basically typing in there. So this hand gear tracks your muscle movements in your arms and fingers and can track which one you're so it's like a virtual keyboard which you can see on the screen. So this is one new forward looking technology. The second one is a eye lens. So it has an embedded chip and a system within the eye lens. So this will give you various parameters such as like what is the air quality, what is the distance from a certain person. So this is a very sci-fi kind of application. If you have ever watched a very sci-fi movie, you will see this kind of technology, like an eye lens with an embedded system. Okay, so this is another wearable technology, which is a futuristic technology. The third one is an interesting one. It's an artificial kidney. So somebody has lost a kidney due to health issues, and he is wearing an artificial kidney as he is walking around. So that's an artificial kidney. So that's a much more complex wearable system. So some of the key issues to be resolved with the wearable technology in the market includes the user acceptance. Am I able to use this actually? Because I can develop a lot of technologies out there, but is this actually useful to the customers or useful to me as a person? So that's one of the key issues with the wearable technologies. Second is security. For example, like I'm wearing this Fitbit watch or any kind of wearable technology. It's collecting a lot of data, like all my movements. I'm taking 5 steps, I'm talking to this person, I'm doing this and that. That is just too much of information. So there are concerns about the security of your data. Does any of this get posted on, let's say, social media, or is somebody just looking at your routine life and planning on some kind of sabotage? Like, so those kind of things are a bit of a concern while we go into the wearable technologies. And the third is the ethics, which kind of ties along with the security aspect, which is how my data is being used and what is being done with it. So fourth slide, please.
Yes, sir. I'm on fourth slide.
Thank you. So let's look at what is the market. This is very important to understand when we work on any kind of technology, which in this case is a wearable technology. So the majority of market is concentrated in US, which is the Western North American market. And India has a huge untapped market. Very few wearable technologies which are developed within India. They are mostly imported. What is the CAGR? More than 46%. So this is compounded annual growth of growth rate. So which gives a metric, how fast is this industry moving, or how fast is the demand coming along? Is the Indian market actually at a demand? So CAGR of 46% is a very large. So that means every year, starting from 2018 to 2019 to 2020, the growth rate or the demand for wearable technologies is skyrocketing. It's increasing a lot. So by 2025, wearable technologies is going to be an $87 billion market, which accounts for rupees 64 with you have a lot of zeros here. So let's say 12 zeros after 6. It's kind of an uncountable set of numbers. So that much is the market. Crores and crores of rupees, like, is going to be the market. So let's look a little bit deeper into what the market looks like. So back in 2018, it was a $9.1 billion market, which by 2025 is projected to be an $87 billion market, almost 9 times of that. So you can imagine how much that is growing, like within just 7 years. So US has a huge market share, more than 32%, and most of the other ones are concentrated in Europe. India has a very its market is at an infancy, so wearable technologies are just coming into picture, and some of the ones who can actually afford a $17,000 watch can buy it, but not a middle class family, like anybody who is studying in a school, let's say, or a student. So that kind of an affordability is still not there. And why is this important, like understanding the market? Because this is how you make a technology. Like if your technology is very high cost, then in an Indian market it is going to fail. So before we talk about the technology specifics, we'll have to understand what the market is. Okay, so Indian market is at an infancy. It's just starting out. Next slide, please.
Yes, sir. Next.
Okay.
I'm on next.
So now we start diving into the details. So the first use of wearable technologies. So I'm going to talk about some of the broad headings. The first one is a prevention of disease and maintenance of health. This is the most key topic in wearable technologies and healthcare. So the first topic underneath that comes into fall identification and prevention. So providing care to aging population has become a significant challenge. This is a global data, like, so uh, global elderly population above 60 years will be more than 2 billion by 2050. So the world is aging, like the birth rates have decreased and the world is aging, so we will have more and more elderly population by 2050, and that means a lot of those are not being taken care of, and they are prone to falls, which is a very big concern, because it can cause deaths, debilitating injuries which can be lifelong, and they might be bedridden. So increased risk of falls, more than 60% injuries and deaths with age, basically. So every 1 second an adult will fall. 1 in 4 adults get a very high risk of injury, and one out of those have a death. So the rate of falls and fall related injuries are very high all across the world, and same goes towards India. So some of the key solutions which are out there in the market is includes an active gait monitoring. What that does is, gait means the manner of walking. So let's say I walk very fast, or somebody walks very slow, or walks in a certain manner. So when you observe other people walking alongside you while you're going to school, or let's say anywhere, while you're standing in a market and walking around, the walking pattern or the gait pattern is very different, and the gait pattern substantially or significantly changes as you grow old. So if we can actively monitor this gait pattern, we might be able to monitor that when you are more vulnerable or when you can possibly fall. Okay, so this is one of the technologies which we are looking at. So how do you do that? So usually within using a smart watch or a bunch of sensors placed on your body, there are accelerometer sensors, and there are position sensors which tell you how your body is performing, how is it moving, is it doing any kind of abnormal walking, and all of a sudden it will show a trigger that change your walking pattern right now. Like otherwise you're going to fall. So if this kind of triggers are continuously given to an elderly person, this is very useful. Like that person has low chances of falling. The second part is, let's say somebody is not very wary of those triggers, he's getting 10 triggers a day. So second part comes as a fall detection. Let's say there is an older person at your house, and somehow you guys are at your office or school, and that person all of a sudden falls. So what happens? Like, does the person just like sit there and like wait for help? But these kind of technologies, how they can help is, they will immediately understand that this person has fallen down and send an alert to the nearby hospital or the ambulance unit, and they will come for the rescue. So there is an immediate attention for any kind of fall related injuries with such technologies, and also including alerting families regarding the same. So you should get the first alert when anybody elderly in your family has gone through an accident, and you should be ready to help rather than sitting for 10-15 hours or waiting for that person to call. Okay, so this is one of the key technologies which is out there in the market for fall identification and prevention. And this picture here shows some of the data points. These are some of the sensors which are placed around the body at different locations, and these kind of tell that fall is detected at a certain point. And this is all done through a smartphone. Okay, next slide please.
Yes, you're done.
Okay, thank you. So the next big concern, excuse me, just one sec. So the next big challenge is with the weight control and monitoring. So this is a very shocking statistics which I recently came across. Over 73% urban Indians, so urban Indians meaning the ones who are living in the cities, are overweight. This is a very shocking statistics. This never used to be the case like 5 or 10 years back. And the second shocking part is, most of these overweight people you would think are above 60 who are probably not moving. That's true. They are in the age group of 28 to 38 years, which is another very shocking statistics. And what that brings out to be, every 3 out of 4 Indians are overweight. So how is this a problem? Let me be overweight. What are the issues with that? So there are a lot of issues, such as, one is diabetes, which causes a risk to the heart, kidney, and nerve damage. Heart disease, you can get very early age stroke. And the third is an osteoporosis. These are some medical terms, but I'll break it down to very simple terms, which basically means weakening of your bones. So when your food intake, or you're very obese, you're very let's say fat is not the right word to use in medical science, but like, let's say obese in this case, then what really happens is your entire body metabolism changes, your bones grow weak, you have a lot of weight on your hip. So there is a lot of chance for hip failure and other kind of falls, and like different kinds of heart diseases and whatnot. So India is sitting at the very epicenter of this, and this is India is being already predicted by 2025 it will be the diabetes capital of the world. So, what are the wearable device technologies which are there uh, for management of this? Is there anything or is there not? So there is currently a lack of reliable wearable devices. So why is that a case? Because we would usually go to a weight machine, or if we see a doctor, he will probably take our weight measurement, but that is not feasible on a day-to-day life. Let's say we are all locked down in this pandemic, and we are eating a lot, moving around very less, working through our computers, and we do not have a check on our weight and the obesity rate, like what all things are changing. So there is currently no way of measuring that, because these are all biochemical phenomena or something where you need to take a we call it an anthropometric measurement, meaning something where you have to measure your, let's say, your waist size or how much fat you have accumulated along your cheeks. So there are a lot of parameters which you cannot do right now with the current technologies. Okay. So one of the recent research, which is on a very interesting research parameter, which is on face pictures, using the facial pictures, can you measure obesity? So let's assume this is the 21st generation. So we are mostly having smartphones, and all of them have a front camera, and we can take a selfie, and we very often take selfies. So can we make our life easier that when we take a selfie, if a system or an app within your system can track that what is my obesity limit, am I getting very fat, by taking different ratios within my face itself. So the face can be put along with different points, so I can put 100 points on my face. There are methods out there to do that, and I can measure how much has my face displaced from here to here versus here to here, and detect an active monitoring of obesity. And if I can do that, that actually helps me a lot, because and helps any of us a lot, because we can go to the doctor in the right time, or start for running or jogging or looking after our health. So physical activity monitor is another set of wearable technology, which is basically a Fitbit or a smart watch based, where you're looking at the number of steps which you have taken, how is your eating pattern, sleeping pattern, how much time you have rested, and stuff like that. But that is not a very active monitoring. That is something which you're looking at an overall picture. But what is really happening to your overall body structure, what is changing, for that reliable wearable device is required, and that is still at a research phase. Second is an eating monitor. So there are a lot of eating monitors which will keep on pinging you on your phone saying, what have you eaten today, how was your morning? So these kind of data is going to generate that you have eaten junk food for, let's say, a week, because you were very overworked and you are eating pizza for a week, so stop doing that. So these kind of warnings are okay. But let's say I fake my this input which I send to the device. I say I'm eating veggies, but actually I'm saying eating pizzas and eating some junk food which I'm not keeping count of. So those kind of things can create problem. That's why there is a reliable wearable device requirement which can actively track how much is your obesity changing. So this is one of the key areas which needs research. Next slide, please.
Yes, done.
Okay, thank you. So coming to the physical activity monitor, which we briefly discussed in the other one. So what is the physical activity monitoring, and why is this useful? So some of the key challenges which we are facing in the 21st generation is a lot of increased work times, like in offices, and very high amount of stress, which adds to a lot of other things which I'll discuss in the upcoming slides. But some of the key statistics are 50 to 70% of us sit at least 6 hours a day on a laptop or a computer, and we are probably not sitting upright all this time. We are constantly slouching or like trying to take some support, and this is changing the way our body functions. Like this is stressing our bones, stressing our cartilages. So a lot of biomechanical changes or body system changes are happening due to this. Also, another statistic is 20 to 35% of us spend more than 4 hours watching TV. So thanks to all the Netflix and Amazon Primes and what all things we watch, our lifestyle has become completely into TV. We want to binge watch our shows, and things are not the same where we get a soap opera like once in a day, like for an hour. So this overall we call it as a sedentary lifestyle, which basically means we are moving, or physical activity is the least all through the day. So what kind of problems is this causing? Heart problems, lots of cholesterol development, high blood pressure, high cancer risk, because of the kind of food we are eating and the kind of heart problems, everything cumulative. Reduced muscle strength, just because I'm not moving at all, I'm sitting in a posture for a very long time, reduced muscle strength. So if I go out to run tomorrow, it's not going to happen with the same stamina, look. So high blood pressure, because we are constantly at a state of stress, we have to finish something within a deadline or whatnot. And another very important part is improper posture, which causes neck pain. So let's talk about some of the solutions which we have here. Okay. So activity monitoring is already a very stagnant market. So there are a lot of activity monitors, mainly in forms of smartwatches and app kind of notifications, which constantly activates, looks at your number of steps, how much you have taken rest, how much you have moved, what is your level, and stuff like that. So have you been sitting, have you been standing, what all things are happening. So that is an activity monitoring which can give you some heads up that you need to really start working on your health. The second part is a posture monitoring. So there has been a lot of devices. When I saw 3 years back, there was just one device which was out there in the market trying to get the of customers. But this device, posture monitoring, what this does is that this is a small device placed on back of your this on your back. So basically what it does on your spinal cord, specifically at a certain spinal peripheral. So what you do is, it's your smartphone keeps on tracking when you're slouching. So what does slouching mean? When I'm bending down, like in bending forward like this, after a certain point, I'm working like this in my computer. Okay, so this is a high chance of causing spondylitis or some kind of like chronic pain, neck pain, which a lot of us are going to face. So uh, I'm assuming a lot of you are students here, but like let's say you go for office jobs in the upcoming days, this is going to be of concern. So these kind of posture monitoring device, or if you're working from home like during the pandemic, is going to help you a lot to understand how to correct your posture. So this keeps on giving you alerts and reminders that you have been slouching for like the last 20 minutes. Put your head up, or stand or walk for 5 minutes before you come sit again. Otherwise, you're going to be in pain like after a week. Okay. So habit change scores, that is another thing which this wearable devices are giving you out. So it keeps on scoring on a day to day basis, that today your score is, let's say, 2 out of 5. You have been doing very poor on how you slouch or how you're sitting. But tomorrow, let's say you have improved based on this posture monitor, it now tells you your score has improved to 5. So this kind of gives you a motivator that I am improving with the smartphone, and you will keep on doing better from there. Another very big and sensational topic here is comes the social media motivators, and we have a slide on that, the next one. So what is a social media motivator for physical activity monitoring? Next slide, please.
Done, sir.
Yeah, thank you. So this is a very serious topic in the 21st century, where we have access to all kinds of social media, including Facebook, Instagram, Pinterest, WhatsApp, Twitter, and WeChat, and stuff like that. Snapchat. Few of them are, I guess, banned for the pandemic, like from the Chinese apps, but like the other ones are still there. So, what are the key problems which are happening due to social media on this wearable? So, one of the key statistics, what it says is most of the wearable users who are using activity monitors are very excited when they're posting some kind of physical activity updates on social media. For example, the first picture here says, I have walked 9,362 steps today, and let's say zero point 0.3 kilometers, and I want to keep on, it posts a map. So from your smartwatch or from your smartphone, you can post this on your Facebook or Instagram, and you get this instant gratification that all my friends are following me, or they're very excited that I am doing this day-to-day activity. So this is one of the market motivators for this technology. The second is check my weight loss journey pictures. So this is another kind of thing which has been revolving around the web. And the reason I'm discussing this is we cannot disconnect ourselves from the social media in this generation. And a lot of our customer decisions or what we buy, how we use it is motivated by that. So likes and followers on my weight loss journey. Let's say I've posted something like this with some nice tags saying this is how I've lost my weight over time using this specific app. And all of a sudden you see a lot of app downloads or a lot of people who are using this Fitbit technology and they want to post the same for them. So that is what is called a social media motivator, and this is motivating a lot of people to work out. So there has been a very recent thing in the pandemic which I have not covered here. People have started cycling all of a sudden, like out of nowhere, like go in the streets and you see 10 people cycling. So this is the new motivator where social media, they have cycled for like 5 kilometers, and everybody gets into that mood that we should also go for a cycling. So that has a lot of impact. Okay, so the next one is slide 9.
Yes, done, sir.
Okay, into much more important issue like what we are facing in 21st generation and mostly in India during the pandemic is a mental health monitoring or mental health status in India, status monitoring. There is a huge challenge in India because of the inherent stress of exams, performing, how you competition among your peers, lot of workload for people who are working mainly in the private sectors, and lot of stress for commuting or getting some work done, like where there's a big meeting, you're trying to get something signed, you're waiting there for hours queue, like all these things are adding to stress. Or here there is a picture of some migrant workers moving from one place to another because they have lost their job, like. So these are there is a lot of stress which is building up in the young generation in India, and every 1 in 20 Indians suffer from depression with a high risk of self harm, where people are extremely depressed, they don't have anything to anyone to share it with. And one of the key issues which is happening due to this is the health budget should increase on this arena, but there is a very limited health budget. Less than 0.06 of our budget is allocated to mental health care. So this is an area where a lot of wearable technology opportunities lie in the upcoming arena. And a lot of these technologies have already been developed abroad in US, but India is still catching up or trying to put more budget into this. And the reason I'm discussing all these technologies are to pinpoint you to the opportunities which are out there for indigenous technologies. And I'll summarize this when we go till the end. Why is all this information very important? Understanding the problem and understanding how we can find solutions. What's also out there which is not applicable or applicable in India. Okay, so there are only 0.3 psychiatrists per 1 lakh people in India. So that's another statistics, very shocking statistics that in India, people don't have, or students don't have anybody to share their difficulties with, day-to-day difficulties. So what is this causing? As a stressor, this is changing our mood and causing a very high amount of stress, which is affecting our blood pressure. So a lot of students or very early age working population is getting a heart attack or a stroke, which was very unlikely 10 years back. But these days you will hear somebody at a 30 is getting a heart attack and you'll be completely shocked and devastated. Indigestion. So a lot of us are facing a lot of digestion problems, like your stomach is upset, you keep on eating, even if you keep healthy, there is some problem with your stomach and it keeps on persisting and you're in some kind of medication. So this is another very key problem of the 21st century. Headaches and panic attacks. This is another thing where after a full day of work you get a headache and you have to really take a nap or take some kind of very strong coffee, or you go through some kind of panic attack because there is some deadline or somebody has told you something. It's like a lot of emotional attack and whatnot. So these are some of the moods and stress based challenges. Another big challenge is insomnia, which is difficulty sleeping. So back in the day, like 10 or 20 years back, we know that early to bed and early to rise makes a man healthy, wealthy, and wise. That was the tagline, but that is not anymore applicable. Like, uh, most of the students sleep around 1 or 2 in the morning. They have to wake up early, take their classes. Even for working population, it's kind of the same. They cannot sleep because there is just so much of stress and things to bother them about. There is a lot of chance about diabetes for this reason as well, because of this prominent health problems. So what is out there in the market to solve this? So there is a prominent lack of reliable wearable devices which can look at your mental health issues, because mental health is a very difficult to track. Like, I might have a different mental health issue as a same person who works in my profession, like, and he might have a different set of stresses and problems. So how do we monitor this kind of things? Can we standardize something? So some of the key metrics which researchers have found out is, if we can monitor the heart rate or the blood pressure, in that case there are some ways to backtrack your mental health. So if your heart rate or your blood pressure is very high, that might mean that you are at a higher stress. So these kind of backsided monitoring can be helpful using your Fitbits or wristwatches and other smart devices. EEG monitoring. So EEG is another set of signal which is electroencephalogram, like, which is put on your head. Like, basically it looks at your head firing signals or a neuronal signals, which is a fairly sci-fi technology for Indian market right now. It is used abroad to understand your mental health situation and to, by research, understand what really happens when you have a panic, when you're observing something which is stressful. Does your neuronal firing in the head or the brain activity completely changes? So this is a very futuristic technology which a lot of researchers are working on. And what has evolved over time is, EEG used to be a very expensive technology and something which you can only used in a lab. So you have to take a session, you have to go to a doctor or a lab and take this session. But these days there are very portable wearables which you can place like a headphone or something like that, and that will give you an EEG average. Okay. Another option is skin conductance. So for example, if you are at a very high stressful situation, you will probably sweat a lot. Okay, so there are some sensors here which we have looked at, which looks at your skin conductance. If the conductance in the skin increases, like, you know that you are getting a panic attack or you're at a high stress. So no solution is there specifically for stress reduction so far. So most of the technologies are mainly based on alerting you that some of the levels might go wrong, but like actual stress reduction at a ground level is still not there. Like, that might need some counseling and some other monitoring devices to come through. Another technology here is like where they're looking at your fingers and how your finger moves. So usually when a person is at stress, you will do certain actions involuntarily. Like, for example, you might move your fingers very often, or thump your feet like very often. So these are some of the sensors which can detect that and backtrack that you are at stress, and the smartphone will tell you don't be at stress. Okay, so this is mental status monitoring, which is a very new topic and has a lot of opportunity in India. Next slide, please.
Done.
Okay, another now comes another field which is very different from the health side, we might say, but it is called sports medicine. So I'll get into that. Let's say these runners are all running here. So how does this runner, which is I think Seema Das, how does she know that I'm going to make it, or actually not get into an injury and I'm going to win this race? So how do you make sure that this is going to happen? So there is no metric for that, so that's why there is a requirement for a area which is called sports medicine, which specifically looks at performance evaluation of athletes. Objective performance evaluation. Objective meaning you're looking at specific metrics: my stamina, how much is my energy after running for, let's say, 100 meters. So these can be only realized through sensors and wearable technologies which you're wearing while running, and which is not very bulky, of course, because you don't want to wear a backpack and run. And the second issue is, I want to avoid all kinds of injury prevention. So let's say this person is training very heavily for let's say Olympics, and all of a sudden before the day of Olympics she gets a injured ankle, so that case she is not going to run at all, right, and waste her entire year of practice. So how do I make sure that we can prevent injuries, and how to make sure she or he can win in a certain area? So in order to specify that metrics, we are using wearable technologies. So what all things are being used? Sensors for tracking of oxygen levels, heart rate, balance, movements. Balance meaning, is your balance okay? Is your balance between your 2 foot? Are you placing a lot of emphasis or loading on your 1 foot, which might let you fall or like lose on your race? What are the kind of movements? Are your movements the most optimized how a runner should move, or am I moving like anything which I want to do? So there is a lot of specificity here which is coming into place, like with this wearable technologies. Another key technique which we look at is, if we look at the figure here on the second, we are looking at the specific movements and angles and how much displacement, every small little detail in this person is being tracked. So how do we do that? We have reflective markers or sensors here, and using a video camera you can capture all this wearable sensors, how they're moving and what are the specific angles. So this mentor or trainer can come back and say, hey, you were putting your front steps like very high, or your swing action or your stride like was very high, please change that, otherwise you're going to trip and fall over and your race is going to be extremely unsuccessful. Okay, so these are some of the wearable technology uses in managing sport movements. The second one is, let's say this person is into boxing. Okay. So we need to understand how much is the force which is being completely applied. There could be a certain force which he is applying due to frustration on something, and all of a sudden his hand gets injured, like, and he cannot box for the next, 1 month or so. So this wearable technology will keep on updating you about the muscle stretch or activity, and this is positioned, let's say, on different parts of your body, including your biceps muscles, and can quickly trigger that please stop training now. At the level which you're training or the amount of forces which you're applying, you're going to break your arm or fracture your arm. Okay, so these are some of the wearable technologies which are placed in different ways. You can either have them as a backpack or as a sensor mounted on your arm, or some kind of wristband or bicep band. Okay, alerts for injury prevention, like I said. Where are these alerts going to come? There could be either a beeping sensor which keeps on beeping and tells you that please stop, or there could be a smartphone which keeps on giving you alerts that your forces have been very high or your angles have been wrong, please stop or change this. Another area is, this is a foot pressure monitoring. So what does this one do? While you're running or doing any kind of sports, you're basically using a lot of foot movement, and there is a very high chance of ankle sprain. So which is a very common phenomena. If you're walking very fast, you can just trip over and have an ankle sprain. So there are some smart insoles or smart pressure monitoring devices which can be just slided onto your shoe as an insole material, and this will keep on giving you updates into your app or phone based app and tell you that your pressure on your heel is increasing a lot while you're walking or running. Please either change your shoe, or stop running at this speed, or stop running at these kind of a walkway, like run on grass, like don't run on like this pavement or rocks, like. So these kind of uh, technologies like cannot be given out by a doctor. Nobody can tell you that this active feedback, that what needs to happen, what your injury problems can be if you keep on doing this. So this can only be achieved using wearable technologies. Another very exciting wearable technology is virtual reality or VR gears, where, for example, if you don't have a huge training field, which in a lot of cases in very various sports India doesn't have, like, so there are a lot of training facilities which are not super upgraded. So where when you're going out to the Olympics or somewhere to really be there, you need to be extremely trained. So how do you train? You have a virtual reality gear, so you wear something like a pair of glasses, and this gives you an entire environment as if you're standing in a field and training. as if you're running or kicking onto a ball. So all kind of small little metrics can also be thrown. So virtual reality is a very new area in which sports training or injury prevention can help a lot using these sensors and wearables. And one of the key factors, all are foreign manufacturers so far, so which gives out a huge opportunity for Indian manufacturers to dive into this in the sports medicine, because sports is somehow like still, which is from a training standpoint, there are very few wearables in Indian market and very few training avenues. Next slide, please.
Done, sir.
Thank you. So now comes to much more disease based, so patient management. So what really happens, so let's say patients who have already encountered a disease or encountered a deadly attack, like through some kind of a disease such as cancer, and their lifestyle completely changes, and there are a lot of wearables which are built around them for helping them to cope up with their day-to-day life, and in order to not be left out, like, so there are some wearables about that, so we'll talk about those specific wearables. So this is a news article which says, will cancer be the number one and killer in India by 2020? And we are already in 2020, and cancer is not the number one killer right now, but heart diseases are the number one killer, but it's the second largest killer in India. And cancer rates are just skyrocketing. Like back in 15 to 20 years back, India would hardly have any cancer patients. Like cancer used to be extremely localized to the West, like American population and European population, owing to their huge intake of junk food, sedentary lifestyle, work pattern, lack of physical exercise. These are some of the key reasons like cancer levels are high. And also a lot of food adulteration. Everything which we eat is there is something mixed to that, not organic, some kind of hormones pumped to our chicken and whatnot. So we keep on hearing these kind of things, but the overall outcome is India is becoming the cancer capital of the world, like going forward. So, and what that is leading the cancer survivors or victims to is a huge amount of low physical activity. So they are stressed out in life. They do not know what to expect because cancer keeps on relapsing. Like many a times, it's not an ultimate cure that somebody has cured, they will never get cancer again. So low physical activity, that person is in depression. High obesity, 70% of the cancer survivors have a huge amount of obesity. Lots of mental health issues because they just cannot connect back with the normal environment. You are not active or looking forward to life. So what that causes is a lot of other comorbidities or problems, like along with cancer, which will increase the chances of a cancer relapse or some other issues like heart attacks to come into picture. So there is currently no wearable for cancer detection. That is a still a hospital or doctor based job where you get a blood test or some kind of detection technique like within a hospital, but not through a wearable. So this is an opportunity area where India is becoming a cancer capital. The second one is a physical activity monitoring devices are used, but these are very passive devices. Like these can help you cope up with the cancer victimization to some extent, but they cannot really help out to stop the onset of cancer in the next form. So these can definitely boost your morale. Smart watches, home-based rehabilitation. So what is a home-based rehabilitation? This is another technology which is coming into pictures because there is a dearth of doctors for the amount of population which needs healthcare attention in India right now and going forward. So home-based rehabilitation techniques are using smart apps where a doctor, you can see that doctor, you can make a video call with that doctor, or based on your symptoms, that doctor keeps on giving you some recommendations. So there are some wearables also they would recommend sometime, like which are placed along with your body, and the doctor can get some alerts and know exactly. So rather than coming to a lab and testing like you would always do, that doctor tells you that do this blood test or do this 5 test and based on that, I'll prescribe you what medicines to take. So you can do that sitting at home by using certain wearable devices which you're using. Okay, so there is this one device which is detecting the skin changes, skin hydration changes, skin cell growth, and based on that can detect skin cancer. The other one is something which monitors your heart rate and has a bunch of chips and sensors which keeps on monitoring your body levels and parameters, and passively looks for any cancer causing problems. And the third one is there is a huge population of breast cancer patients, so this is a uh, wearable clothing for making sure or detection of early breast cancers, and looking at how you can improve that. So there is no mental health monitoring wearable for cancer survivors right now. This is another opportunity space. So no cancer detection and no mental health monitoring wearable so far in the Indian market. Next slide, please.
Done.
Yeah, thank you. So the second topic here is the patients with stroke, and we keep on coming back to stroke because this is one of the key issues in India, and it's even bigger than the COVID. Like it's COVID is a very instantaneous thing which happened, like, but stroke patients are skyrocketing along with cancers, and this is going to be a chronic problem, and it's going to increase drastically in the next 5 years or 10 years. So 33% of stroke-based deaths in urban areas. Rural population is still at a much more ease because they are at least eating healthy and like doing a lot of physical exercise. Like given our life in the urban areas, which where we have a sedentary lifestyle, the amount of cholesterol is increasing. We're eating all kinds of junk food. The amount of stroke population is increasing. 900 per day daily die under 30 years, which is a very shocking new statistics, like I was saying earlier, which never used to be there. Like till 50 or 60 years, you never have to worry about your health, 15 to 20 years back. But this has been extremely important in the 21st century, which needs the improvisation and starting of new wearable technologies. Increased chances with age, of course, that is there because your body gets through a lot of changes and vulnerabilities. Um, so these are some key statistics, and the news reads India staring at a heart disease epidemic. So it's very strange, like that heart disease could be an epidemic, but this is the news topic, like that heart disease is going to be an epidemic, which is going to completely be at every household. Somebody would be a heart patient. So some of the solutions right now include a activity monitor. There are that includes the smart watches and some sensors which can provide feedback to the patients and therapists. So you have a strap along kind of heartbeat monitor which can be placed on the chest, or you can have a pulse beat monitor, and this will straight on keep on telling you in your app that this is your heart rate or this is your blood pressure. And this kind of information can also be quickly transmitted to your e-health person, or your some doctor who is sitting in his office who is very busy attending a lot of patients, and that doctor can probably quickly reply saying this looks good, or please come visit me, this is serious. So these kind of monitoring things are changing in the 21st century thanks to the smartphones and a lot of internet usage. So feedback to the patients is very important because like what has been happening earlier, and which is a good thing in the 21st century, is you would wait till you see the doctor till the very end. So a lot of people are in the middle class families are very reluctant that we will see the doctor, oh, it's okay, it's fine, let's take some medication, let's take some over the counter things. But when things are at a very end, they see the doctor. But right now with the apps and all, you can daily monitor your activities and see what your heart rates and some vital signs are, what your temperature is, and these things. So these are sending alerts to hospitals, which is a good thing. But one of the key issues is includes the expensive smartwatches. These are not very affordable smartwatches which can be used by me or you or anyone. Like these are still that way localized to the ones who can afford it. Next slide, please. Thank you.
Yes, done.
So another issue is with the patient management, patients with brain and spinal cord injuries. Okay, so this news reads just 15% of the head injury victims make it. What does make it means? They're not making anything. Make it meaning they survive. So only 15% of the head injury victims actually survive. Rest of them die over time. So how does a head injury occurs? Like mostly because of the lot of vehicles which we are driving on. So a lot of car accidents, lot of falls while we are extremely stressed out looking at our phones. So these days, like, things have changed. We are always looking at our phone while walking, so a lot of chances of falls. There are car accidents. If you happen to some of my colleagues, because they were on their phone on the street because they're constantly checking their emails and whatnot. So patients with brain and spinal cord injuries, which happens due to these kind of accidents, are very common. And one of the common terms which encompasses that is called a traumatic brain injury, which initially is not that harmful, but over the time causes memory losses and like headaches, and then you have blood clots in your brain. Like, things can happen, and over the time you might develop symptoms which you won't think you will develop, and there is a high chance of death. Okay, so another thing which happens, death is one part. That, okay, you have come to an accident, you die, that's like the end of the story. But the problem comes with when you get injured, and that stays for a very long time. So one of the key problems with patients with brain and spinal cord injuries is motor function loss due to the nerve damage. So what does that mean? So spinal cord actually tracks all our nerves from our top of the brain to the different parts of the body, including our limbs and the foot, and all the voluntary organs which we can move goes through the spinal cord. So if some kind of damage or accident happens to the spinal cord or the head, then that causes a nerve damage, and that might cause complete paralysis, or you cannot move your limb, or some kind of problem like with your arm. And this usually happens sometime after the damage. And there is a very low recovery for these kind of issues, and this is a very common thing which is happening all across the world. So some of the solution for that is exercise and training to improve. So that's the only solution. There is no medicine for that specifically. So you have to keep on training your nerves in order to overperform and make sure you can move your limbs. So one of the very expensive and futuristic technology which is used widely in US and other developed nations is an exoskeleton. So exoskeleton basically means, exo means something which aids your skeleton. So exoskeleton aids movement. So you can place this entire exoskeleton on your foot, and while you apply a very small amount of force, let's say your foot has got 70% paralyzed due to some nerve damage during your accident, this exoskeleton helps you place the entire amount of force and let you walk normally. So, and this also helps you to train your body that by this much amount of force I can slowly increase the amount of force and come back to normal, hopefully. Okay, so exoskeletons are built widely in China, Japan, and other countries where there are arm exoskeleton, where this one is basically this is driving, and this applies a physical force. So based on, if you apply a small amount of force on your finger, let's say you cannot move your finger to hold a glass for drinking water, this amounts the extra amount of force automatically and helps you train that how can I move my finger. The other one is brain signal monitoring, which I've seen using a EEG portable device, where you can keep tracking that this is my brain activity, how I can improve that, how I can improve my motions. Okay, so patients with brain and spinal cord injuries, this is a very new opportunity for making exoskeletons in India. Next slide, please.
Done.
Thank you. So the next very big issue in India is chronic pulmonary patients. What that this one means? So breathing problems. So what caused the most deaths in India in 2016? We are looking at a statistics. The first one is a heart disease, which is heart attacks, like I've said. The second one, which is right now cancer, but at that time was an obstructive pulmonary disease or some kind of breathing problem. And why is obstructive pulmonary disease a problem in India? Because Indian cities such as Delhi, or lots of other cities like Kolkata and Mumbai are some of the most polluted cities around the world. The air quality index is just over the top. Like if the critical index is 400 or 500, Indian cities go well beyond that. So that causes over 8% chronic obstructive pulmonary disease, which is cumulatively called COPD patients in India. Second leading causes of death caused due to most polluted cities. So we are continuously breathing this air, and there is coughs. Winter, it even goes worse, and you keep on coughing, and this is going to be a very difficult season with the COVID pandemic, where if the pollution level rises as the unlock, India is more prominent, like in lockdown is still not there, more vehicles will come out and more pollution. Then there is stubble burning in Delhi and places near in Haryana. So the air quality is going to be very bad, and you're going to cough, and probably you will suspect yourself to be a COVID-19 patient. Like, so there are a lot of challenges with Indian pollution system. So what kind of, do we have any wearable technologies in this arena? Yes, there is. So there is a breathable air quality monitoring, and this is a Indian technology, which is a very proud Indian technology. This is from Nasofilter, I think. I forgot the name of the company. So the technology is called Nasofilter. Basically, what it has is, it's a simple patch you put in across your nostrils. So it kind of covers your nostrils. So rather than wearing a full mask, you're putting a simple patch across your nostrils, and this has some air quality monitoring sensors, and this sends continuous update to a smartphone app and tells you what air are you exactly breathing. Because let's say Delhi has an AQI of or air quality index of, let's say, 350, but that does not mean you are breathing 350. You might be closer to a place where they are burning a tire, or really is polluted because they are doing some stubble burning. So what exactly are you breathing? Or you're closer to the industry. So this technology is a very proud Indian technology which can monitor this. Uh, Besides that, there is air quality monitoring. Of course, you can, when you go out, and this has been very prominent in China. Like what I have been seeing in India during the pandemic is been the same situation in China 4 or 5 years back. So I was in China, and basically you have to wear a mask all the time because the air quality is so bad you just cannot breathe it. But right now they have changed it drastically. That's a different topic, but breathing exercises are required if you are constantly going through a coughing system, and like you have been exposed to really poor air. Improvement tracking, you have to keep on tracking how your breathing improves, and you can do this through this wearable technology. Okay, so let's come to the next slide, please.
Done.
Thank you. So the next slide is on disease management. So we were so far talking about patient management. Patient management is people who are already facing through some kind of difficulties due to their chronic conditions, or something has already happened. But there comes another set of wearable technologies which are for disease management or diagnosis, like for you to get prevented from not getting a disease. So that's the second class of this wearable devices. The first one, as I said, like we keep on coming back to the heart disorders because that's the most prominent in India. So low power wearable ECG monitoring, like these kind of wearables which you can place first figure underneath your clothing, and then you can keep on getting updates like on your cell phone, like, or your smartphone, on how your ECG is performing. Textile, if your ECG is like the ultimate, if it really goes bad, you can go see a doctor or consult somebody. There is another class which is a textile based wearables. It's a very new set of technologies where you don't have any bulky wearables, because these wearables are uncomfortable. When you place something on your body or something is strapped to your biceps or arms, it's very uncomfortable. Like after a certain point, you don't want to wear it unless you really need it. So there are some e-textiles or textile based wearables which has sensors already knitted into the dress. So all you have to do is wear this clothing and just be okay with it. So this will automatically detect your heart rates and other vitals for your body temperature and whatnot, and can give you some updates on your cell phone. So this is another very key opportunistic technology. And India being a textile hub of the world, this is a technology we can futuristically invest in. Ear-based BCG blood wearables. So this basically looks at the blood flow or blood flow rate closer to your ears, which also gives a idea of like what your heart condition is. So this is another set of wearables. Second is a blood disorder. So blood disorder basically accounts for blood pressure monitoring. So this is very important. If your blood pressure goes really up, you have a high chance of heart attacks. So blood pressure monitoring can be actively done using a smartwatch. Okay, and lots of finger-based and other body-based sensors which can be applied on your body. Diabetes care, which is another area, blood glucose dynamics. So diabetes, what really happens is your blood glucose increases a lot, and with time, if you have a lot of blood glucose, you get lots of different kinds of heart problems, diabetic ulcers, and like kidney problems and like things like that. So blood glucose monitor is another thing. Like here, the third row, if you see, there is a small patch which is placed on your biceps, and you have a blood glucose monitor. Another disease which is upcoming in India is Parkinson's disease, and this is a pretty well-known disease in the United States and Europe, which is basically a brain-based disease. What happens in this disease, long story short, is elderly people usually get tremors, and all of a sudden, while they're trying to bend or lift something or do something, their hand or foot gets completely locked, and all of a sudden they just cannot move for like 50 or 30 to 50 seconds, like, you know. So what do you do in that kind of a scenario? That's a very difficult scenario. You can fall down like in from a stair, or like while you're trying to bend, you, if you lock, you can out of shock fall down. So a lot of these people undergo fall injuries. So the way to do that is this technology in the third row, last figure, and this is a tremor detection. So tremors can be detected from the fingers. They are the ones which go through a lot of vibration. So either through elderly people not very good with the smart apps, so you can probably have a buzzer or some kind of sound device which gives you an alarm that you are facing a tremor, so keep on placing a small amount of force. So these are training devices to help you cope up with this kind of Parkinson's disease. It has no physical proper cure way, and this is an upcoming problem in the Indian market as well. You have problem focusing and mental training. So there are a lot of headgear based wearables which are being developed in order for order for them to focus and look at something which interests them on a day-to-day basis. Okay. So just two more slides, and then we will be wrapping this up. So next slide, please. What are the major challenges of wearable technologies in India? So we have talked about this great, like lots of different wearable technologies which are out there, which is all great, but we have to understand the challenges in India. Otherwise, it's of no use to our study or going forward. So one of the key issues to address is the high cost. So where most of the wearables are imported and not affordable right now. So India is a very hot market, and this is probably the right time where things are changing into digital in between this pandemic to get into this market and go for a low cost. Second is developmental skills. So what does this one means? India doesn't have the right skill sets like at the research labs or prototyping facility from a standpoint. So we have mostly, let's say, enrollment of BTech or engineering students or some commerce students. So they are not skilled enough to build prototypes similar to top research labs such as MIT or somewhere in the US. So this is another skill set based issues. That's why the wearable technologies are not coming, and it's very difficult to translate the knowledge to products. So we are doing a lot of studies, and like we're understanding the fundamentals, but a lot of marketing knowledge, how the product has to be launched, what does the customer need. So these kind of things have to be understood because before you can launch a successful product. So difficult to translate the knowledge into successful products. The second issue is user acceptance. So in India there is a huge lack of awareness about wearable technology. So this is probably we are all fortunate to uh, be able to look into Google and look at what the wearable technology market looks like right now, but very few people around India actually know what is out there, what they can possibly even use. Patients and clinicians don't want to work with them. So we are still in a very traditional system where we visit a doctor, the cost is usually low, they give us some prescribed medicines, or we come back for a few tests. So doctors and clinicians are still not ready unless they have a huge amount of funding for research, or they are connected with like some healthcare institutes, like let's say in Fortis or Apollo Healthcare, like where they want to work with them. Like they, even the patients are not interested, that this is an expensive device and I have to deal with this, charge this and XYZ, and like this is a problem. Like user acceptance is a very big issue. So more difficult to sell prolonged wearables. So if you tell a patient that this you have to wear for 3 years, they are going to run away. Like this is another challenge in India. If you tell them you will have to wear this for just like 20 minutes a day, they might still buy your wearable. But if you tell them you're going to wear this all your day and sleep with it, they will run away from that. So these are the challenges right now facing India. So these have to be streamlined with all the newcomers efforts and innovations from your side. The fourth part, it's not a huge issue right now, but it will come up as an issue, is the security, which is confidentiality and data security, which is a huge issue in the Western market. So a lot of data which is being collected from your wearable might be used against you by some of the uh, uh, some of the manufacturers who keep on updating your app or charging you a recurring fee, or showing you that this wearable is not updated, take a new one, and sell strategy might change. But these kind of things are still in infancy, because India is at a very new market for wearables. So with that, I come to my last slide. Last slide, please.
Yes, done.
So basically looking at future opportunities. So this is all the knowledge we have gained, and I'm sure Dr. Kalyani has this, and please feel free to pass this along to the students if this is of any use. Uh, some of the key requirements, we have studied about this wearables, but how can we as individuals or students or academicians contribute to this arena? So one of the key things we have to look at is cost reduction. We have to make cost effective designs. We can use either 3D printing, which is a easy thing to which is an easy device available in schools also these days, and also in institutes. Use 3D printing, make innovative designs. This is a very low cost, use low cost electronics, like which is used in you have a huge market for this in India. So India is a very hot pot for cost reduction, and you can sell them within India and also abroad. Like, so these are some of the opportunities to earn. Startups, we all have to go to this, and as Prime Minister Narendra Modi has said, like recently, this Atmanirbhar Bharat, we have to, that doesn't mean that we don't have to go for jobs and start doing everything on our own. The main idea is we focus on making something for India and starting something for India, which is useful for the country and for our own sustenance. Like startups on development of innovative wearables in India. So this should come as the next strategy for the next 5 to 10 years. If students are willing to partner with research institutes such as IITs, NITs, government institutes, fine institutes like yours, like I think students should be more than happy to reach out to uh, the institutes and specific professors with their interest. I never deny anyone. Like from my perspective, I've seen my colleagues also like being very happy working with students. So please come up with ideas. If we can train you to develop the innovative wearables in India, we'll be more than happy to. This third one is user friendly. We have to make things very user friendly. We have to understand the customer sentiments. If we make a very complex product and a bulky product, I have to wear like a backpack all day, people are not going to buy that. Okay, so we need to first of all make a user friendly product, promote awareness that how is this product actually going to benefit you. Like we need to probably make a very big awareness campaigns. This has to be taken up as some of the school projects, or like some of the extra internships which student can do, and you have to reach out to people. do customer discovery, develop easy to use products only. So focus on easy to use products only. So one of the key problems with engineering sector in India has been, we have traditionally looked at very complex products, very difficult to make products, which makes us look like as we are doing a very complex task. Like, this is not rocket science. This is where we have to look at very specific health problems. Let's say somebody has a pulse beat issue, so somebody has come up with this smartwatch which can monitor this pulse beat. Somebody has an issue with their eye, like, make something for that. So look at specific problems and make an easy to use product. Understand the customer pains and needs. This is very important. So we cannot sit down in our lab and just make a product and think that this is going to be a huge success. We have to reach out to the customers and do a huge survey, and understand what is your exact need. So what are your pain points? Will you use a product like this before we dive into a product? And the last part, which is a very hot topic right now and has become a buzzword, is artificial intelligence. Might be very early for the youngsters, but this is basically uses ethically collecting of data for better clinical prediction. So this comes more into the coding. When you have a lot of data, you can clinically predict that this is going to be the outcome, and take certain decisions, alerts, and make predictions for the diseases. So with that, I think I would close off my presentation and open up for any questions which anybody might have.
Actually, I have one question. So shall I ask question?
Yes, sir. Please.
Okay. My question is, what are the sensors that can be used in this wearable technologies?
So thank you for taking a time to hear out to me. So let me just go through a few of the questions. So there are lots of different kinds of sensors which we use. One kind is a pressure sensors, which we can look at any kind of small pressure changes, like due to pulse beats and whatnot. Then there are specific air quality sensors for the nasal filters. There are accelerometer sensors which looks at acceleration while you could fall. So what are the accuracy of these devices is another question which I'm seeing. So I'll answer to that. Most of the sensors are very accurate, but the device outcomes, like I mentioned, depends on if it's a passive device which is helping out with the cause, or is it an active device. For example, there is no device for looking at cancer detection, but there is a device for looking at the heart rate, which could be a pressure based sensor, or can be a force sensor specifically. I hope I'm still audible. I'm just trying to scroll through some of the other questions.
Thank you very much for such energetic and motivating sessions.
Absolutely.
Yeah.
Thank you for having me, and thank you for your time and hearing out to me.
Yeah, thank you, Dr. Arnab. It's really nice interacting with you, and
Same
we
here.
look forward. Yeah, we look forward. Let's see if we can collaborate on some of the products.